Assalamualaikum and good morning. I'm Nuruna Soha binti Muhammad and my group member is Rahatul Bani and Amir Aizat. Today we want present about medical health and response. We all from group 3.
In the first 3 hours of a disaster response, the medical and health concern, injuries should be the top priority for medical intervention and followed closely by dehydration and infection. Injuries become priority number 1 is because particularly severe trauma such as fracture, laceration, crush injuries, and bleeding are the most immediate threat to life and require rapid attention. If not treated promptly, injuries can lead to death or permanent disability. The priority action that can be taken, for example, is stop bleeding by apply pressure to control active bleeding and use tourniquet if necessary for severe hemorrhage. The next one is stabilize fracture, immobilize fracture to prevent further injury. And the last one is use triage system to prioritize care based on severity and the likelihood of survival. The next immediate medical concern that should be addressed are dehydration. Dehydration can quickly become life-threatening, especially in a flood situation where people may be exposed to contaminated water sources or are displaced from safe water supplies. Severe dehydration can lead to shock and organ failure if untreated. Priority action that can be taken for dehydration is needs to immediately hydrate, administer oral rehydration solution ORS or IV fluid to anyone that showing signs of dehydration, for example dizziness, dry mouth, and confusion. The next one is monitor for shock. Rapid fluid resuscitation is necessary to prevent hypovolemic shock. The last one, immediate medical concern that should be addressed are infection. Infections are a significant concern due to contaminated floodwater and open wounds. They typically do not present any immediate life-threatening risk in the first few hours compared to injuries and dehydration. Infections like those caused by waterborne pathogen can worsen over time. Priority action for infection is wound care by cleaning and dressing wounds to minimize infection risk. Second one is antibiotic. Administer antibiotics where appropriate for infected wounds or signs of tetanus. The last one is prevent further exposure.
Next is how you deploy medical teams and supplies to the village. First point is mobile clinics. We set up temporary medical stations in central locations, allowing healthcare professionals to treat patients without the need for them to travel long distances. These clinics are equipped with essential medicines, wound care supplies, and hydration treatments. The second one is emergency transport. Medical teams use ambulance, motorcycles, and even boats in remote areas to reach patients quickly. Airlifts may also be arranged for critical cases requiring urgent hospital care. Third one is local health workers. Partnering with trained local health workers ensure a faster response. These individuals are familiar with the community, can identify urgent cases, and help distribute medical supplies efficiently. The fourth one is supply chains logistics. Medical supplies such as antibiotic, IV fluids, bandage, and water purification tablets are sent through well-coordinated supply chains. Partnership with humanitarian organizations and government agencies help ensure continuous stock and distribution. Last but not least is communication networks. Establishing radio or mobile communication help coordinate response efforts, ensuring that team reach the most affected areas first.
Okay, so my name is Ami Aizat from Group 3. So in order to prevent the spread of waterborne diseases, firstly you need to make sure that everyone affected by the flood stays away from the flood waters. um, they need to establish minimal contact with the flood water, and then for all sources of drinking water, we need to make sure that all the drinking water are boiled first, especially and to not drink from tap water or any other sources that might have been contaminated by the flood water. And then thirdly, um, the the people in the affected area should also cover their open wounds, if there are any open wounds, and prevent the open wound from being in contact with the flood waters.